India is battling the world's fastest growing surge of COVID-19 cases. Hundreds of thousands of people are testing positive each day, and likely many more are falling ill. Now, the country is struggling to make strides with vaccinations.
For months, they were exporting tens of millions of vaccines to other countries. Once numbers started going up, the government essentially halted almost all exports out of India to reserve them for domestic use.
That crisis is causing ripple effects across the world. Here's why that is. India has a critical role in global vaccination efforts.
India is not only a major player in the global economy, it's also a major player when it comes to global vaccines. And many of the plans to vaccinate the developing world were contingent upon India being able to manufacture vaccines.
The Serum Institute of India, the world's biggest vaccine maker, signed on to supply the shot developed by AstraZeneca and the University of Oxford for an initiative backed by the World Health Organization, among others. The goal was to supply free vaccines to 92 low and middle income nations. After India largely stopped exporting its coronavirus vaccines, that initiative, called COVAX, was forced to slash the number of shots it plans to ship by the end of May.
We're going to have the entire world basically on a delayed timescale for vaccination.
Roughly 5 months into the vaccine rollout, less than 4% of the world's population is fully vaccinated. But doses haven't been distributed evenly among countries, a situation that threatens the race to beat back the virus. In recent months, countries from Indonesia to Rwanda have had to rejigger their vaccine rollout, with some countries pausing their campaigns and others looking elsewhere, often to China for supply. The Serum Institute doesn't just supply vaccines to the developing world. It has also filled orders to developed countries like the UK. When manufacturing in India will ramp up enough to meet demand is unclear. This is putting pressure on Western governments to support waiving vaccine patents and on companies to supply millions of doses to developing countries as quickly as possible. Those vaccinations are crucial to countries' abilities to manage and minimize severe cases and hospitalizations.
Basically, every single hospital is overwhelmed. It doesn't matter where you are. Infections are spreading in rural India as well. It's everywhere, and it's just burning through the population.
I think it's very important to realize that the situation in India can happen anywhere.
With just over 2% of India's nearly 1.4 billion people fully vaccinated, a large percentage of the population is still vulnerable.
Starting May 1st, everyone 18 and up, so all adults, are eligible to get the vaccine. That's some 900 million people.
And even with exports halted, there aren't enough doses to vaccinate everyone who wants one.
They went from lopsided one way in that there was very little demand and quite a lot of supply to now a ton of demand from people who are really scared and think that vaccinations are the only way to end this. The other kind of factor thrown in that's probably an accelerant to what would already have been a surge are the variants.
A new variant emerged in India that has some concerning mutations, one of which could make it more contagious. The country is also grappling with the more transmissible variant from the UK.
When a more contagious variant arises in a geographic area, it means that you have to get better at containing, because this virus is going to be less forgiving when it comes to lapses in wearing masks, lapses in hand washing, lapses in social distancing.
Scientists are still deciphering what threats this new variant poses to India and to other countries. The more any variant spreads, the more opportunity the virus has to mutate and create additional variants. New variants could increase the risk for reinfection in people who were previously infected with other versions of the virus. And available vaccines could become less effective, which could put a dent in global immunity. The key to ending this cycle is increasing vaccination rates, especially in the most vulnerable populations.
The longer this pandemic rages, even in one part of the globe, the longer our lives will be still not back to our pre-pandemic status, that the world is interconnected, people travel. It has to be a priority to fight this virus wherever it may be if our goal is to return to a pre-pandemic life and to have as minimal disruption from this virus as possible.